Hi, Team Population Health. Thank you for your presentation on the Singapore healthcare system. It was very unique. It was definitely the most unique of all the presentations we've had in this class. I think it effectively captured the feeling of walking through an actual wing in a museum, and reading about all the artifacts housed there. I do have a question regarding the important figures involved in the creation of Singapore's healthcare system. It's quite well known that Lee Kuan Yew is seen as the sort of benevolent dictator that shaped Singapore's lasting success. So, from your perspective, what do you think were his views and impacts on the healthcare system as it exists today? From ChatGPT, I told it to compare the Singaporean health care system with that of the US. It responded with a brief rundown of comparisons across numerous dimensions, such as the financing and cost for each system, who it covers, how easy it is to access, and the resulting health outcomes for each country. In my opinion, for the US to adopt a universalized system such as Singapore's, it the biggest issue would be the cultural, political, and economic opposition towards making such a radical change. Culturally, Americans generally enjoy the concept of having their own choice in selecting health insurance, and so most likely the idea of a publicly funded universal health system would probably be heavily opposed. Um, Such a change probably wouldn't make it far in legislation either, as many private stakeholders would be opposed to this radical change, such as pharmaceutical companies and private health insurers. They can lobby lawmakers to take a stand against this. So I think to effect a change of this magnitude, it would probably require an immense public education campaign designed to convince the public that the current fragmented network of American healthcare is ineffective and that switching to a system similar to Singapore's would result in better public health outcomes. I work in the field of clinical research, specifically for mental health related pharmaceuticals. So I would think that there would be a reduction in research towards high cost marginal diseases, and that would shift towards higher value and impactful drugs, which I feel will be more meaningful from a public health perspective.